Paper-assisted scleral simulator. The authors have no financial interest. India, a land of culture, diversity, heritage and the second largest contributor of the world's total population. With substantial increase in populace above 50 years of age, the load of cataract blind people would increase up to 8.25 million in the year 2020. And the quantum of cataract surgery would also be doubled to 7.3 million in the same year. With the vision of eliminating needless blindness, approximately 44% of Tamil Nadu's total cataract load is being operated by the Arvind Eye Care system alone. Owing to this, n number of ophthalmologists are being trained in cataract surgery by Arvind year by year. This immense responsibility in training and sculpting their newly fashioned surgical hands lies on the educator, who upskills the basics and teaches a proper conventional method of ocular microsurgery. As the budding hands are going to change the future of eye care, this manual SICs bestow the stepping stone for phacoemulsification all over the world for any ophthalmic surgeon. Cataract microsurgery is not just removing the natural lens and placing the IOL inside the eye. It is way more than it. Young residents with full enthusiasm when enter the operation theatre are usually mesmerized by the act of performing surgery. But the hitch emerges in training the hands of amateur surgeons while starting their surgical walk of life. Tremors of the hand, palpitation, sweating, increased heart rate creates a stumbling block leading to fear, anxiety and further landing onto complications. But to master the initial triplanar sclerocorneal tunnel on which the whole surgery is dependent is challenging, as if the tunnel incision goes too deep, the iris keeps on prolapsing, making it difficult for further steps. And if the tunnel incision becomes superficial, it results in buttonholing. So any direct attempt may jeopardize the patient's eye. So to reduce this, we already have a well-equipped wet lab, where young surgeons can practice and program their hands accordingly. Learning and performing on goat's eye or a human eye is not always possible. Moreover, there is also a limiting factor for those used inside the operation theatre. Considering it, we analyzed various materials which can replicate the surface of the sclera to some extent. Hence, we tried and tested easily available materials such as papers and cardboards of different thickness. On further exploring, we grabbed an idea of practicing tunnel on a sheet of paper which had a peculiar thickness of 0.25 mm. Those were our regular sheets which were used daily in our hospital. A detailed study was required about this paper, so we asked our residents to practice on it by making an incision with 15 number blades and fashioning the scleral tunnel by crescent keratome, further wriggling inside without perforating the paper as we do while making the tunnel. As this method became popular among novice surgeons, we decided to increase the magnitude and to give them a feel of making a scleral tunnel in perfect human eye. On further researching, we came across a tracer sheet. The importance of this tracer sheet lies in the fact that if a paper is designed in an exact pattern, the resultant flower-shaped structure gives an approximate curvature of an eyeball without any breach on joining the edges of the paper. With the help of the tracer, we were able to get our target structural base required for the tunnel practice. But the main problem we still faced that we lacked a holder which can clutch the paper over the eyeball. Sticking the paper with a gum would knock down the purpose of making it reusable. So we thought of making it by a 3D printing technology. 3D printing process builds a three-dimensional object of complex shapes and geometries designed by a computer by successfully adding materials layer by layer, which is solidified under computer-guided software. By this, we designed a holder-cum-stand model in CAD software and calibrated it in correspondence to sclerocorneal junction. After 3D printing it, we fixed our pre-cut tracer marked sheet of paper over it to practice. This is how our paper-assisted scleral simulator, also known as PASS, came to existence. To our expectations, the results were far appreciable and promising. Now residents were able to practice as many times even in the OPD and their home, as it didn't require the wet lab and the microscope. They could even practice inside the OT, which provided them more finer and softer hand movements required for a good microsurgery. So we have finally innovated a low-cost effective technique for the tunnel practice by locally available materials. PAS can be used for practicing different surgical steps like scleral tunnel, trabeculectomy, scleral flap, scleral tear suturing, etc. and can also be used inside the OT. Thus, the most important initial step of cataract surgery, which usually increases the heart rate of young surgeons, will now be much easier to master. Now forget your past by using PAS and have a great surgeries ahead.